So PRP stands for platelet-rich plasma. And essentially what this means is we take a patient's own blood, and there is a special machine called a centrifuge machine, and it separates the different layers of the blood. And we separate a particular layer called PRP, which is platelet-rich plasma, and the rest of the cells are discarded, like white blood cells and red cells, etc. The advantage of this fluid, as in the PRP, is it has lots of growth factors and therefore beneficial in tissue healing. So it's been widely used over the years for a common condition called tennis elbow, which I'm sure a lot of you may have heard of. Based on the success of that, it has been used for various other conditions like tendinosis or sporting conditions of different tendons or joints. For example, it has been used for things like Achilles tendinitis, which is around your heel, patellar tendinitis, which is a tendon around your knee joint. It has been used for early arthritis of knee and a few other conditions. So PRP injections are still being widely examined, and lots of studies are being conducted worldwide. It certainly has shown benefit in tendon problems, as I just mentioned before. In terms of meniscal tears, there is no significant evidence at this point in time to show that PRP injection can help heal meniscal tear. It has been tried for early arthritis of knee or other joints with some benefit. It has been shown useful for some other conditions like tendinitis around the heel, around the knee, as I mentioned, and around the hip, like trochanteric bursitis, abductor tendinitis, etc. So this is generally done by a specialist knee surgeon who has a setup for giving you this PRP injection. So you generally come into the hospital, and once appropriate consent has been signed between you and your surgeon, what we do is we draw some blood off your arm, and about 10 to 12 mils of blood is generally taken. That syringe goes in a special machine called centrifuge that separates the different layers. That on an average takes around 10 to 15 minutes. So the patient just waits around for that time. This can be done in a clinic setting with a treatment room, or it can be done in an operation theater setting, depending on the surgeon preference. So after about 10 to 15 minutes, once the PRP is ready, that injection is administered to the area of need by the surgeon. Any injection is painful. Depends on where the injection is being given, but if it's expected to be quite painful, some local anesthetic can be administered before, but generally it's very well tolerated by most patients. It's extremely rare that somebody cannot tolerate that. The short answer is yes, and the long answer is that you generally wait 2 to 3 days after the injection. Just do your day-to-day activities, but avoid any strenuous activities, avoid any sporting activities. Let that settle into your system. And after that, you can recommence your sporting activities, exercises, etc. without any problems. In terms of the benefit after the PRP injection, patients fall into different categories. It's very rare that some patients feel the benefit straight away. Generally, it's a more prolonged benefit, as in a few days, few weeks, patients start to feel the benefit. Certainly, if it's done for like tendon healing, etc., the interval scans, if you do a pre-injury scan and then a scan a few weeks after the PRP injection, you start to see the healing of the tendon, etc., in a few weeks' time.